Hi, I'm Mina Salib. I'm a pain management doctor here at Sure. Really, pain management is a kind of like a multi-modal kind of picture that we look at the patient as a whole, from pain that's been going on for a few weeks to pain that's been a decade or more. We're focused on an interventional aspect of the pain management. So utilizing different procedures that are advancing every day to kind of treat everyday pains. The things that we are doing the most of consist of neck and back pain. So back pain meaning pain that's in the back, and what some people think of as sciatica pain, that pain shooting down to the legs, anywhere from every kind of joint in the body, really, from the elbows to the knees to the ankles. Patients with occipital pain as well. So really the pain is kind of focused centrally in the back and the neck. However, we're really kind of diving into all different kinds of pain here. We're going to be doing our procedures in the OR, but when people think about the OR, they think about this big old procedure. No, a lot of these procedures, thankfully, are anywhere from 5 to 25-minute procedures. So patients are coming in, they're getting the procedure. A lot of the times they'll get immediate relief from that procedure. Sometimes it may take a little bit of time, but a lot of times it's very nice because we see by the time they walk out of the doors, they're already receiving some of that relief. For the most part, there's really no cutting, there's no incisions. So really it's a small fine needle using some local anesthetic. So patients are coming in that day and leaving that day. Most of these procedures, no sedation is required. So that's a nice part of it. I started as a Wolverine at University of Michigan, Flint actually. I grew up in the Flint, Michigan area. Followed by University of Michigan Flint, I went to Michigan State, went to the Spartan land for medical school after that, and really great experiences in undergrad and medical school. And so I finished my emergency medicine training in Detroit, and then I decided during that time period, I love the ER, I love the fast-pacedness, but even before the time that I got into the emergency medicine, I really had some great mentors at the Cleveland Clinic that were in pain management, and they were showing me the advances in pain management, what they did, and I really enjoyed it, and I thought that was one of the coolest fields. But again, I loved the ER. I didn't want to give that aspect up, and I think ER is a big part of my life still, doing mission work and kind of serving outside of the Michigan area in different countries. And so having the opportunity to go into a field that could follow up with my patients and could see that improvement, that was something that really, really drew me to that field. And I ended up doing the fellowship in Pittsburgh. So that's where I did my training for pain management. On the intervention aspect, again, we focused anywhere from the very simple knee injections that we were doing either under x-ray or just by landmark that a lot of physicians are doing, to the very advanced things that most people aren't even aware of. Some things like spinal cord stimulation, where we're actually stimulating the spinal cord to prevent some of that pain that patients are experiencing. A large patient population that we treated was our post-surgical back pain patients. And these patients have had surgery for one reason or the other. And for the most part, these surgeries they're getting stability from, and a lot of the times they're getting some form of pain relief. But sometimes they do have pain after surgery, like any surgery can have pain. And so spinal cord stimulation has advanced in the setting of neuromodulation, meaning how are we going to modulate the signals to the brain to block some of that pain going to the brain. I recently moved back to Michigan from Pennsylvania to be closer to family and friends, and kind of wanted to be in the hospital setting. I actually didn't know much of Sure Hospital. A lot of people kind of gave me very good input about the hospital. And to be honest, initially I didn't really take it seriously. I came and wanted to see what the hype was about. And from the second I stepped into this hospital, it was greetings and just the amount of kind of family, that a family kind of environment that I noticed. Everyone knew each other by a first name basis. Physicians that I met, really without them knowing I was going to meet them, telling me that this is one of the best places they've ever worked at. And so I think having, that small town family vibe, I think really attracts people to this hospital. And just having that gratitude and having that Thanksgiving to have the opportunity to be here, to have the education, and to kind of have that humility aspect of healthcare, knowing that when a patient steps into our office or steps into the OR, that I'm looking at that patient as a family member, a brother, sister, mother, father, grandmother, kind of treating them just the same way as I treat my family members. And I think that's kind of one of the best ways, I think, to look at our patients. I am Dr. Mina Salib, and I am sure.